My name's Jeff Cook. I'm president of the Greater Fairbanks Community Hospital Foundation and president of Foundation Health Partners. And we appreciate your being here. We've got some exciting news we're going to talk about today. Just a little bit of a brief history, how we got to where we are today. December of 2015, we made a decision based on the best interest of our community that we would not continue our relationship with Banner Health. And we entered then in January of 20, and so gave a year's notice that at the end of 2016, Banner would no longer be our operator. So January 1 of 2017, we became independent. At 11:59, I was sitting in the Nerlin room. At 12, I was sitting there at 12:01, and nothing happened. Nothing blew up. We were working, and I want to thank our employees. I'll tell you, that was a tremendous effort. Over, I think, 2,000 items on a checklist and thousands of forms and signs and logos to change. People put in a lot of time. We really, really thank you. And I think as we move forward, we're all very knowledgeable that this was the right thing to do. Our mission as Foundation Health Partners is putting people first and focusing on our community. And becoming independent gave us a lot of opportunities. We don't have to be Phoenix-centric. We don't have to be Renton, Washington-centric. We don't have to take a package of services from them. We can go out and look at what's best for our community, what are the needs of our community, and we can tailor what we do here to Fairbanks, Alaska, and the citizens of Fairbanks. So that independence allows us that flexibility. We're going to continue to excel in providing the best care possible to all our patients. We're going to continue to excel in being a choice of a place to work. People want to come here and work. We're going to become a location where surgeons want to use our facilities and patients want their surgery here. And we all are going to control our future. And we're going to talk a little bit about how we can maintain independence yet have the services of the best to make us even better. So thank you for being here. I'd like to introduce our CEO, Dr. Greg Johnson, to come up. And I apologize, I'm the only one not wearing a tie. This is Fairbanks, Alaska, and it's summer. Dr. Johnson, or as I said to him today, Dr. Who?
Yes, for the longest time we thought this was a tie-free zone, but we're learning. This is a good thing. Foundation Health Partners over the last, since its inception early last fall, it's been a tremendous journey. We've gone a lot of miles and done a lot of things. But today it's about an announcement that we're making, and it's an announcement for the benefit of our community and for our caregivers. To kick things off, we'll go ahead and just show you a brief ad that's going to be running on the television here in the coming days.
How do we solve our patients' hard-to-solve medical problems? Our doctors and specialists collaborate, sharing their vast knowledge and Mayo Clinic's unique expertise. It's this working together that helps solve our patients' hard-to-solve medical problems. Fairbanks Memorial Hospital and Tanana Valley Clinic, proud member of the Mayo Clinic Care Network.
There you have it. Today, Foundation Health Partners becomes the newest member of the Mayo Clinic Care Network. We become the 46th member of that network. We are the first in Alaska to have that designation. It's an extensive evaluation process that we went through to achieve this goal. And what it did after going through all the effort to get things prepared for that evaluation, their review of the evaluation, we found from that that we share many of the visions that Mayo Clinic has. It's exciting for us, it's exciting for the community and our caregivers. The important thing, as Jeff mentioned, is we still maintain that autonomy, that independence. We're still locally owned and still locally operated. This is totally a community benefit. It's a collaborative relationship. It includes clinical aspects. It also includes non-clinical aspects. So the support that we would expect to receive from this type of relationship not only impacts the nurses and physicians that provide the care, but it also impacts the administrators that oversee the operations of the hospital. We can find best practices throughout the Mayo system. With those 46 members, we have a tremendous resource that we can tap from. And in addition to that, it's the expertise that, in the name Mayo Clinic, we have those resources that we can constantly refer to. And as Jeff mentioned, it's not something that will be pushed on Fairbanks. We will reach out and look for the best possible solutions we can find. So it's exciting for us. We have a partner that shares our mission, vision, and values. We look forward to the relationship, and thank you all for attending. We'll have a few more comments and a question answer period for the press afterwards. Right now I'd like to introduce Dr. Danny Robinette, our Chief Medical Officer for Fairbanks Memorial Hospital.
Thank you, Dr. Johnson. I'd like to welcome everyone here this morning for this announcement. We're tremendously excited about this opportunity. The mission of Foundation Health Partners is people first, community focused, excellence every time. This partners very well with our new collaboration with the Mayo Clinic, who has a 150-year history of focusing on the best interest of their patient and bringing the leading edge in education and research to bear. This gives our physicians and your physicians as patients the resources of the Mayo Clinic to help provide the best in care right here at home. This is not meant to be a track that flies everyone out to the Mayo Clinic. This is a collaboration between physicians that allows us to have that resource and use it right here in this community. You will continue to have your relationship with your physician. They will access these resources to help in your care, and this will not be in any way an interference in that. This is really a tremendous opportunity for bedside resources. We really have access to the resources that are used at the Mayo Clinic by their physicians in the care of their patients. So it really allows us to be a partner and collaborate with them in an amazing way. And these tools, we've been trialing those and using them, are really amazing. We've shown them to some of our physicians and they're tremendously excited. So I think this is a wonderful, great opportunity for us here in this community to raise the bar in our level of care and keep things here at home. I'd like to introduce Dr. Larson from the Mayo Clinic, who's going to give you an overview over that.
Thanks, Dr. Robinette, and good morning, everyone. On behalf of the Mayo team, we are really pleased and really excited to be here today to share in this exciting announcement with you, the joining of the Mayo Clinic team along with those who are part of Foundation Health Partners. We look at this collaboration as a way to improve patient care everywhere. So the Mayo Clinic Care Network was developed a number of years ago to allow us to kind of extend our reach, to be able to share clinical expertise, clinical trials and education that could improve the health care of patients everywhere. And this partnership with the Fairbanks community and the patients of Fairbanks, we think, is particularly exciting. You know, this, as you all well know, is a very special region. And also with your geography, your topography, you know, many things are special about it, including the providers, the nurses, the docs, the providers who work in the hospital. This is indeed a very unique healthcare environment. It makes it really special for us to be able to participate in some meaningful way in the care of patients here in the greater Fairbanks community. At the Mayo Clinic, we've been in business for over 150 years. And yes, we're very proud of our heritage. We're very proud of our brand. It's a very trusted brand name. And we're very proud of the care we deliver to our patients each and every day. And I think, as Dr. Robinette and Dr. Johnson mentioned, we can now extend the Mayo Clinic to the providers and to the patients of the Fairbanks area. How we do that will unfold over the next couple of days and in the months ahead. but we're now able, through a formal, non-contractual relationship, able to share clinically meaningful information. We can discuss patients together through formal electronic mechanisms to participate in the care of patients who have received their care here. This implies in no way a gap or a lack of resources here. You indeed have outstanding professionals, nurses, docs, mid-levels, all aspects of the system here in the Fairbanks area. But this allows our resources to complement your resources. So if we have a specialist or even a subspecialist in a problem that your patient in Fairbanks need, having this relationship with the Mayo Clinic now allows your providers to reach out to us. And if we can participate in the care of your patient by sharing knowledge, by sharing clinical expertise or tool and services, that's what this relationship is all about. So over the next couple of months, we hope that you all have a chance to touch this relationship in some way, whether it's through the electronic tools and services, whether it's through an e-consult, whether it's having one of your patients participate in a tumor board where the Mayo Clinic experts can consult together and then contact your provider about what they feel is truly in the best interest of your patients. As Dr. Robinette mentioned, this in no way implies there's an obligation to refer patients to Mayo or elsewhere. Your providers are always in charge of the patients here, what's best for them. Our goal and our hope, and I'm sure it's yours as well, is that we in some way can participate in that care, that you can call upon us when needed, and trust that this relationship will bring great value to the hospital, to the providers, and most importantly to the patients of the greater Fairbanks area. And at this time, I'd like to present Dr. Johnson with our crystal, which signifies the entry into this relationship with the Mayo Clinic. So Dr. Johnson, the crystal reads, Mayo Clinic welcomes Foundation Health Partners to the Mayo Clinic Care Network, June 14th, 2017. Congratulations.
Thank you. Light shine through that okay? Great. Thank you for all the employees. We have an event at 5 p.m. Open house. Ask the questions that you have. That'll kick off at 5 p.m. For any members of the press, if you're looking for any one-on-one questions to be asked, we'll make ourselves available following this meeting. So thank you all very much. Appreciate it.